afternoon, I am Vicky McCullum with the Thursday edition of Our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. It's been 3 months since the World Health Organization declared a worldwide state of emergency following COVID-19 outbreaks across the globe. Today we will show you opening remarks from the World Health Organization press briefing marking the milestone. We also spoke to the MEC of Health in the Western Cape, Noma French-Mbombo, to find out her department's plans to curb the virus in the province. We encourage you to get in touch with us. We want to hear from you as we welcome contributions from movements, healthcare providers and our audience. We want this program to be a two-way flow of information, so please get in touch with us. Moving to the news. It's day 35 of the national lockdown. The total number of confirmed COVID-19 cases is 5,350, with 2,073 recoveries, and the total number of deaths standing at 103. Lab National Health Laboratory Services staff members based at Groote Hospital have tested positive for COVID-19. This has resulted in the temporary suspension of certain activities. Hospital spokesperson Alaric Jacobs confirmed that changes at the NHLS lab would not affect operations during this period. The hospital would continue to put the health and safety of its staff and patients first. The ban on the sale of cigarettes is set to continue despite an earlier announcement by President Cyril Ramaphosa that it would be lifted as the country entered level 4 on Friday. The government received over 2,000 submissions from the public opposing the sale of tobacco products. The announcement was not well received by smokers and the tobacco industry. Over 270,000 have signed a petition against the ban on selling cigarettes. Here are visuals from the briefing.
There are things in the economy that will continue not to be allowed. As we said, alcohol is not allowed yet on level 4. On Saturday, we had said we're consulting. In that consultation document, we had consulted about allowing cigarettes and related products, tobacco, and as you remember, even at the press conference itself, there was quite an opposition to that. And even in the public comments, there was quite a lot of opposition. More than 2,000 people opposed it. And of course, the government then took that into consideration, debated the matter, looked at it, and decided that we must continue as we are when it comes to cigarettes, tobacco products, and related, that we should not open up the sale of products. And the reason are health related. The reasons are health related. As you know, besides the effects of tobacco itself on the person's lungs, but also the way sometimes tobacco is shared does not allow for social distancing, but also actually encourages the spread of the virus, because when people share a cigarette, obviously if one of them has the virus, it will be shared amongst them, and then they'll go home and then spread it at home. And even those who do tobacco and make I don't know what you call it, like a zol, imboza. Yes. Sometimes when there's zol, I'll read at some stage what one person said about that zol. Because he says when people zol, they put saliva on the paper and then zol. And then they share that zol. So it means they are also if one of them has a virus, they are sharing that person's saliva, but also they are moving saliva from one to the other. So there were lots of health-related reasons, COVID-19 related reasons why people said we shouldn't open on tobacco. So the sale of tobacco and tobacco products, e-cigarettes and related products is not allowed.
Authorities were left baffled yesterday after they bussed more than 8 minibus taxis near Elliotdale in the Eastern Cape. The taxis had managed to travel from the Western to Eastern Cape without being stopped at 2 different borders. They had invalid permits and were carrying 8 people. King Sabata Diliebo, Municipal Public Safety Portfolio Head, Councillor Tsebo Makea said passengers had finished seasonal work harvesting apples and were on their way back to their home villages. Another proposed City of Cape Town change to a bylaw has been called into question as its constitutionality. The city wants to amend its streets and public places bylaw to allow searches and seizures without a warrant in certain circumstances. Councillor Mkazwe Kavashe, chairperson of the city's Safety and Security Portfolio Committee, told Ground Up News the purpose was to give additional powers to officers to enforce the bylaw and bring it in line with the Criminal Procedures Act. The city hoped the amendments would allow their officers to deal more decisively with serious crimes such as proliferation of drugs and gangs in some communities. It's time for an ad break. We'll be back shortly. Welcome back. You're still watching the Our City COVID-19 show with me, Vicky McCullum. We will be giving you the latest updates on the COVID-19 pandemic and sharing essential resources and information with you. The Western Cape's confirmed COVID-19 cases now stands at 2,135. The rapid increase in the number of infections is a major concern, as this is the highest number of cases recorded in a 24-hour cycle. We spoke to the Western Cape Health Minister, Noma French Mbombo, about the current state of play in the Western Cape and the measures put in place to ensure everyone's safety.
We are screening everywhere. Actually, we have expanded the screening and the field screening, and it's possible that the next week we'll share the dates and the time where we'll be conducting mass community screening and testing. In addition to that, we're following up the close contacts, we trace them so that if they are symptomatic, we also could be able to be screened. We also do screening and testing even around the factories, which are the key hotspots and the clusters. We have seen also that in the prisons, among the South African police, the supermarket workers is where we have most of the clusters. So we do have a plan for massive community screening and testing. As I indicated earlier, most of our bushfires, which is the origin of what transpired, what contributed to the large cases, is mostly from these big clusters, where I made an example that in the ShopRite, in the factories, in the agri-processing farms outside the metro, in prisons, in South African police. So that's why we find that we have had so many of those. And then those people work outside where they live. For example, you might be staying in Lavender Hill, but you are working in Maitland. So meaning that you have been infected in Maitland, but you have to now carry the virus back home in Lavender Hill and infecting your close people that you stay with. plus also your co-workers. So that's what happens, that it goes across. When an area has got a high infection, let's give you an example in the Tiger Black area or the Khayelitsha area. It's not necessarily that the infection is like the epicenter per se, because some people are working outside the Tiger Black or outside the Khayelitsha subdistrict. So they could be working in town, which is the western, or they could be working somewhere in Somerset West, which is the eastern, or they could be working in Durbanville, which is the northern. So that's how it works.
Meanwhile, the Department of Education says there is a possibility of schools being opened, starting with grades 12 and 7 on the 6th of May. Unions are challenging the proposal. This is what Minister Mbombo had to say about the issue.
There will be time where, just like with the economy, there will be time where we might have to open, because we cannot have the status quo remaining permanently because of the issue that will impact on poverty and all of those. Meaning anything in that aspect, it will also impact on health. For us, we open, we welcome when the economy, when the schools ended up opening. However, all of this, there should be precautions and measures that are put in place. As long as that there will be social distancing, as long as that there will be hygiene, including surface hygiene in the area, as long as the issue of checking whether there is no cross-infection. So I'm not sure at what extent when it comes to the children, they will even remember to put up their mask. I'm not sure whether they will be able to remember, for example, that there is nothing past the place. And maybe the research where we have international is that children are not necessarily getting infected themselves as much. It doesn't hit the children hard enough at this stage. However, they could be the carriers themselves. Look at how my teachers, in their books, when they are coming from parents who are positive, in their books, in their backpack, in their clothes, they might bring it to the school, and then the teacher gets infected, or the other child gets infected, carries the same, and then back home. As you know that the virus can stay longer in some of the, like whether in the plastic or in the format. So that's the concern we have. And also, we don't even know whether the teachers themselves are not infected. I'm not sure whether there will be screening for the teachers first, and also there's a confirmation in terms of the social distancing. So from health perspective, things must be put in measure, whether it's at the school, whether it's in the workplace before people return, and also the correct clothing, the PPE for that kind of an industry or sector, including the school. At what extent also the teacher will be protected, for example. Same applies with the learner to learner.
Yeah.
With the increase in COVID-19 deaths and the Western Cape now being the epicenter of the dreaded coronavirus, we spoke to Chief Director of Metro District Health Services, Dr. Keith Klutter, for more on this.
Good day and welcome to the Our City COVID-19 show. This morning I have with me Dr. Keith Klutter, who will be talking to me about the current state of the Western Cape as it has now been declared as the epicenter of the COVID-19 pandemic. Good day, Doctor, and thank you for joining us.
Good morning, and good morning to your viewers.
So, Doctor, as we start the discussion, what does it mean for the health sector now that the Western Cape has been declared the epicenter of the COVID-19 pandemic? We have heard the Premier Alan Winde say that at its peak we can expect 80,000 cases of COVID-19. Can we still expect this? And what is the total of the deaths related to COVID-19 at this moment?
Yes, what it means for us in the Western Cape is that we have what we call established community transmission of COVID-19, which means it is now being transmitted between people in the public on an ongoing basis in specifically the city of Cape Town, and then also in Witzenberg, which is the Ceres area, outside Cape Town. Because it's established transmission, that means your risk of contracting it is very high. in public places where you come into contact with others. The total number of deaths we have to date is 38 deaths. That's all been related to COVID-19.
Doctor, as we see more essential staff, specifically those in the medical field, become infected with COVID-19, what measures are put in place to ensure that this is actually flattened or curbed?
We take all measures that we can, maximum measures, to make sure that healthcare providers are protected. And that means we've got an occupational health and safety policy that we've had to revise because of COVID-19. And we have very strict measures in place to make sure that all healthcare workers are maximally protected in terms of potentially coming into contact with somebody with COVID-19. So they must have all the protective gear. They must have everything. The spaces are clean, and maximum distance in terms of maintaining social distancing. So that is all part of what we call infection prevention and control. And this protective gear is one element of the protective prevention and control measures. But it's also important to realize it's not only healthcare workers that are at risk. Every other person that goes to a workplace or place of gathering is equally at risk. So also as a health department, we've been advising other sectors, and particularly sectors such as the supermarket chains, prisons, police stations, and all other workplaces. We provided guidelines for them to similarly look at occupational health and safety and to look at infection prevention control in their settings and the necessary protective gear that all the personnel should have in coming into contact potentially with people that has COVID-19.
When it comes to those working in mortuaries, what steps do they need to take when it comes to working with someone that has just passed of COVID-19? Are there certain steps that are followed, and how are they being taken care of? As we know, there is a lack of protective personal equipment within South Africa.
So we have, right from the outset, from the start, have prepared our staff that works in forensic pathology services and people working in mortuary services to be able to handle the body with care. And as part of that is to give them protective gear and very strict and clear guidelines of how to manage the body and all the bodily fluids associated with that. So we've got a very strict protocol in dealing with that, because a number of cases that we've actually picked up is where we've had unexplained deaths, and we've taken samples after the person has passed away and only a day or two later. Because of the early stages of this, our forensic pathology services have become involved to work with people on what is the appropriate handling of the body. So the body does get handed over to undertakers, and the undertakers we work with is to give them guidelines of also how to manage the body with care. And the body is either being for cremation or the body is for burial, and it's very strict observance with us and the undertakers of how to manage the body.
Yeah. As we see the number of COVID-19 cases increases, when people get sick, we know that there has been 17 triage units that has been set up. Have all of them been set up successfully, and are they actually being used?
We have 9 that has been set up to date. We have another 9, so that makes it 18 now, that we're busy with, and will be ready by the second week in May. But because also of Witzenberg and what's happening there, we might have another center, which is a 19th center, which might then be at Ceres. So to answer your question, we have 9 of these places that are in operation. And what happens, it's big areas outside of the hospital, and it's basically to stream people that comes for COVID testing outside the hospital, and only the ones that has been tested and triaged and has been seen as a case will then be referred back into other places.
Last question, Doctor, before we end. Should we brace ourselves for more COVID-19 related deaths, and where specifically will we see the most of these cases happen? As we see it pops up as in a various variety of places over the Western Cape.
We can expect more deaths. I think part of the increase of the number of cases you're going to see is you're going to see the number of cases increase, and we're going to see the number of deaths increase. And as you say, the deaths is likely to be wherever there's established community transmission, and that makes it almost every single part of the city of Cape Town, and in places like Witzenberg when there is established transmission as well.
Thank you so much, Doctor, for your time. And thank you for the viewers of Cape Town TV for tuning in. Back to studio.
Today marks 3 months since the World Health Organization declared a public health emergency following the COVID-19 infections across the world. It seems Africa has more than one battle to fight, though. On Monday, the World Health Organization director delivered a worst-case scenario, saying the number of malaria deaths in the sub-Saharan Africa could double. Now, let us take a look at yesterday's opening remarks at the WHO headquarters.
On the 30th of January, I reconvened the emergency committee, and after receiving their advice, because of the new information they gathered, they had a consensus. I declared a global public health emergency, WHO's highest level of alarm. At the time, as you may remember, there were less than 100 cases and no deaths outside China. To be specific, we had 82 cases outside China and no death when we declared the highest level of global emergency. From the beginning, WHO has acted quickly and decisively to respond and to warn the world. We sounded the alarm early, and we sounded it often. We said repeatedly that the world had a window of opportunity to prepare and to prevent widespread community transmission. We started our early press conference. People were saying, you know, the world would be tired of you if you're making a press conference every day. But we didn't mind. We wanted to make sure that the world understands what we are saying. WHO is committed to transparency and accountability. In accordance with the international health regulations, I will reconvene the emergency committee tomorrow, because it's almost 3 months since we declared the highest emergency, and that was what was suggested by the emergency committee, to reconvene 3 months after the declaration, to evaluate the evolution of the pandemic and advise on updated recommendations. In the 3 months since the emergency committee last met, WHO has worked day in, day out to sound the alarm, support countries, and save lives. We have worked with countries to help them prepare and respond. We have brought countries together to share experiences and lessons learned. We have brought together thousands of experts to analyze the evolving evidence and distill it into guidance. We have convened researchers to identify priorities from all over the world. We have launched a large international trial to find answers fast about which drugs are the most effective. We have brought together a consortium of countries and partners to accelerate the development and equitable distribution of vaccines, diagnostics, and therapeutics. We have shipped millions of test kits and tons of protective gear all around the world, focusing on those countries who need our support most. We have trained more than 2 million health workers, to be exact, 2.3 million health workers around the world. We don't think that's enough. We will continue to train more. We have worked with tech companies to fight the infodemic. We have kept the world informed in multiple ways, including these regular press conferences answering your questions. We have brought together entertainers to provide music and laughter, even in these dark times. Using this opportunity to thank Hugh Evans, my friend from Global Citizen, and Lady Gaga for bringing the whole world together. And we have watched with admiration as the world has come together in solidarity to fight this common enemy. We share the grief and pain of so many people around the world, and we share the hope that we will overcome this pandemic together. There is one thing we haven't done. We haven't given up, and we will not give up. We won't. Our commitment remains to serving all the people of the world with science, solidarity, and solutions, but above all, with humility and respect to all people and nations. WHO is now working to provide the critical strategies, solutions, and supplies that countries will need in the coming weeks and months. One thing that we would ask is unity at the national level and solidarity at the global level. More than ever, the human race, humanity, should stand together to defeat this virus. I have said it before, this virus can wreak havoc. It's more than any terrorist attack. Said it before. It can bring political, economic, and social upheavals. But the choice is ours. And the choice should be unity at national level. The choice should be global solidarity, standing in unison. The choice should be humanity against this virus. I thank you.
After the ad break, Octavia and Lovu will have the latest on social media. Stay with us.
Welcome back. Before the ad break, we had Vicky McCullen with the latest news. Resident representative of the United Nations Development Programme South Africa, Dr. Adula Abdulsa, warns against fake news during COVID-19 lockdown in the country.
Hello, I hope you are keeping safe wherever you are on the nationwide lockdown in South Africa. As the United Nations, we are tasked with looking at what impacts humanity on a daily basis and how to make the world a better place for the most vulnerable of us. In a crisis, this is even more critical. And in my thoughts around what matters most right now, it is only leadership and solidarity that is going to get us through this. The President of South Africa has shown leadership in making the decisions he has made for the country's safety. It is our own turn now, yours and mine, to take that leadership and lead with solidarity. Leadership is about thinking before acting, setting an example for others. Solidarity is ensuring that we do things for the benefit of all, not just for ourselves or only a few. In the crisis we are facing now, we are only as safe as the sickest person in our country, continent, and the world. This disease does not understand race, gender, age, wealth, borders, and even status. It does not conform to humanity's sense of hierarchy, but it does attack the most vulnerable of us all, and those who are uninformed and unaware. Based on this, today, I want to talk about fake news and the impact that disinformation and misinformation has on making this crisis so much worse. If leading is about thinking and acting, then are we thinking before we act? When we share information, are we thinking and checking that all that we share is indeed factual? Are we holding ourselves accountable for the information that we feel we should share? We could be arrested after all. And also, are we thinking about whether we are the right people to share this information? It sounds like a lot, I know, but we are living through a crisis not experienced by this generation before. Fake news leads to people not following instruction or not taking precautions seriously, or worse, thinking that every symptom they have Googled is a sign they have the virus. Healthcare workers need to focus on the most critical, and they cannot be distracted. We need to keep ourselves safe and informed. The old adage rings true: knowledge is power. Build our knowledge from reputable sources and thrust only information from the right places. Think before you read or look at something, and ask yourself a very simple question: where, who did this come from? I am Dr. Ayodele Odushola from the United Nations Development Program in South Africa. Let's spread facts, not fear.
And now for social media. Share your thoughts with us on Facebook, we are Our City CT, and on Twitter at Our City CT. This is a time that we need to come together as a nation. These are the popular hashtags on Twitter today. Hashtag Dennis Goldberg. A truly great South African has fallen. One of the last surviving Rivonia trialists who went to jail for treason for 22 years. Anti-apartheid activist Goldberg was 87 years old when he died in the Hout Bay on Wednesday night. Hashtag DSTV. Television viewers are sick of repeat programs on DSTV and are being very vocal about their unhappiness. Over 100,000 people have signed a petition asking DSTV to cut prices. After the ad break, we'll be crossing over to Vicky McCullen, who will share information and resources of places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned to Our City, the COVID show with me, Vicky McCullum. Before the ad break, Octavia and Ndlovu looked at what has the nation buzzing on social media platforms. For the latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune into Cape Town TV daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send us your comments, news and questions via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via email ourcity@capetowntv.org. This is a time that we need to come together as a nation, so if you're not sure about something, send us your questions and we'll try to find the answers for you. You can also call us on 021 448 0448. From me, Vicky McCullum and Octavia and Ndlovu, have a great long weekend. Goodbye.